Good evening and welcome to a press conference by the Democratic Labour Party. I am Senator Andre Worrell, the spokesperson on health and wellness, and I want to go through with you a statement on the scabies outbreak at the geriatric hospital. Sources indicate that the reported figures regarding the number of patients and nursing staff infected with scabies at the geriatric hospital are significantly higher than those presented by the Chief Medical Officer in his preliminary report. Currently, there are up to 24 confirmed cases distributed across 5 wards. The detailed breakdown is as follows. Ward 6B, 2 cases. Ward 8B, 15 cases, which will be all patients on that ward. Ward 9B, 3 cases. Ward 10B, 2 cases. And Ward 9A, 2 cases. This outbreak has had an impact beyond just the patients. It has also taken a toll on our nursing staff. Currently, there are 6 nurses who are unable to work due to this outbreak. And information reaching me today indicates that that number has now gone up to 7 nurses. 1 nurse diagnosed with MRSA, another nurse who has been oxygen dependent and on extended leave since October 2024. And there's a nurse who has developed abscesses on the hands caused by mites, and she has been absent for work for over 4 weeks. Since January 2025, numerous nursing professionals have submitted medical documentation indicating significant environmental concerns within the hospital. Unfortunately, these critical warnings were disregarded by hospital management and the issues remained unsolved. This situation reflects serious negligence on the part of both the hospital administration and the Ministry of Health and Wellness, which bears the ultimate responsibility for ensuring the safety and care of elderly patients within the facility. Another concern is the shortage or lack thereof of basic medical supplies, which has intensified the crisis. For example, nurses are forced to share only 6 bars of soap across 3 shifts. Staff are buying soap from their own pockets and supplies are not being replenished. No scabies treatment has been provided to infected nurses. They are told to seek care from private physicians or polyclinics. No PPE, this is personal protective equipment, has been issued despite confirmation of an outbreak by the Chief Medical Officer. Communication has faltered significantly regarding the outbreak. Nurses and staff are receiving information via media reports, much like the general public, which is concerning. The silence from the Barbados Nurses Association and hospital administration is alarming, as they have not taken steps to advocate for the staff or ensure safe working conditions. Reports indicate that patients are presenting with lesions in various areas, including the groin, neck, back, breasts, and abdomen. Families of patients currently at the hospital are strongly encouraged to reach out and request updates on the conditions and treatments being provided to their loved ones. Additionally, there is a pressing issue with the hot water system in the laundry facility, which is currently non-operational. This poses a critical risk as hot water is essential for disinfecting linen and clothing to prevent the spread of the scabies mite. The situation is increasingly concerning and appears to be deteriorating, posing a risk of managed with urgency, risk of transmission beyond the hospital environment into homes, schools, and workplaces. With the upcoming Kwapover Festival, the potential for wider community spread is notably high. We call on the Minister of Health to publicly acknowledge and address this health crisis. The situation must be declared a national health emergency, communicated fully to staff and patient families, managed with urgency, transparency, and accountability. The Democratic Labour Party stands in full solidarity with frontline staff and families affected by this outbreak. And we go further. The Democratic Labour Party commits to ensuring that our entire health sector returns to those days where Barbadians can feel proud, safe, and cared for. We urge immediate and comprehensive action to prevent further suffering and restored public confidence in our healthcare institution. We wish to offer a few prevention tips to staff and to families, as scabies infections are very contagious, and the number of persons who may be at risk, because it not only spreads to the nursing staff who will be in direct contact with the patients, but if the laundry is not working, if the laundry does not have the adequate hot water facilities, there's also a risk too for the laundry staff being infected. So to prevent the spread of scabies, a highly contagious skin infection caused by, please follow these hygiene and treatment protocols. 1, treat all close contacts. Everyone in the household and anyone with prolonged skin-to-skin contact should be treated, even if asymptomatic. Avoid skin-to-skin contact. Refrain from direct contact, including sexual contact or bed sharing, until treatment is complete. Wash clothing and bedding in hot water. Use temperatures of at least 60 degrees Celsius and dry on high heat. Items can be washed, and items which cannot be washed should be sealed in plastic bags for at least 72 hours. Vacuum thoroughly. Clean carpets, mattresses, and furniture. Dispose of vacuum contents immediately after use. Do not share personal items. Avoid sharing towels, clothes, razors, or bed linen. And follow treatment carefully. Use prescribed creams or lotions as directed and apply them to the entire body. A second treatment after 7 days may be necessary. Monitor for symptoms. Watch for itching, rash, or burrows, especially around fingers, wrists, elbows, or waistline. Notify close contacts. Inform anyone who may have been exposed, including schools or elder care facilities. This outbreak demands urgent, compassionate, and coordinated leadership, not silence and denial. The health of our elders, our nurses, and the wider Barbadian public depends on it. I want to go further. I don't know if we have the photos available. The issue at the geriatric hospital, it speaks more to environmental issues within the facilities and poor management of the facilities. You have a situation where nurses are being intimidated to work on the wards with infected patients, even though these nurses spoke out against it. You have a situation where infected patients were moved to wards with persons who were not infected, and this has resulted in the spread of the infection. The chief medical officer reported only 9 cases, but from the information which I shared earlier on the number of wards, there are over 24 cases in the patient population and more than 7 nurses who have been infected with scabies since the outbreak. We also know that the matter was raised since January 2025. Now, scabies is one of those infections which requires contact tracing. And as long as you have an infected person with scabies, the correct procedure, which should be followed by the infection control nurse or even persons from the environmental health department, will be to go through the procedures to do the contact tracing to find patient 0. It is highly unlikely that the patients within the geriatric hospital brought it in unless it was brought in by a new patient. It could have been brought in by a staff member who was already infected, or it could have been brought in by a visitor. But it's important that you identify and do the contact tracing. Scabies is highly contagious, and if we do not deal with this matter in this issue in a timely manner, you can eventually see this infection spreading in the schools, because the nurses and the staff at the hospital, when they leave work, they go home to their families. And if they are infected, they can infect their families. And if the families are infected, they can infect the schools and the workplace that they go to. And you have the crop over season coming up, a season where we are in high contact with each other. We would not want to have an outbreak of scabies. Don't want to run the country into fear, because it is a highly treatable disease, but it needs to be properly managed. You need to do the contact tracing, and this is not the time for the government and the Ministry of Health to act as though it is in denial and not share with Barbadians the appropriate facts. And that is why I again urge Barbadians who have patients within the geriatric hospital, it is your right to call, as they are not allowing visitors, but to call to make sure that your family members are being properly taken care of. I cannot imagine the torture that these persons are going through, because scabies it causes intense itching of the skin, and you break out into lesions. Cannot imagine the torture that they are going through. You also have to address the issue of inadequate supplies within the healthcare facilities. This is not just an issue at the geriatric hospital, but it seems to be a problem which comes about from our IMF agreement and the cuts which are being made to please the IMF agreement. Imagine a hospital, a ward, having only 6 bars of soaps to last a week, and this is being used by 3 shifts of nurses. And when the soap runs out, they're not being replenished, and you have nurses having to bring in their own supplies to take care of the elderly patients. This is not good. And the fact that the hot water system within the laundry is not functioning, it means that you will never be able to properly treat the linen, the clothing, the towels, the sheets, all of those things that are being used by infected patients, and you run the risk of exposing the laundry staff to infections. You know that there's a scabies outbreak, the nurse should be issued with PPE. There is an isolation ward at the geriatric hospital. Why is this ward not being utilized? And I understand that only 1 patient is in this ward, with at least 4 nurses working on this ward who receive hazard pay, but they want to put the infected patients on other wards where these nurses do not receive hazard pay. This speaks to poor management and planning within the Ministry of Health and the geriatric hospital, and we urge the Minister of Health to come to the people of Barbados and give us the true details of what is happening with our elderly patients within the geriatric hospital. Thank you very much for your for joining me for this press conference, and to the members of the media here with me this afternoon. I would now invite any questions or comments which you may have.
Just one from me. I missed a bit of what you said at the very beginning, but if you could perhaps give your take on the way that the situation has been handled or is being handled by the Ministry of Health.
The situation is being handled poorly. At the beginning, I would have mentioned yesterday, the chief medical officer reported that there were 9 cases. So a lot is being hidden from the public as to the true incidence of the scabies outbreak. First of all, they did not want to say it was scabies. There's absolutely nothing wrong with saying that there's a scabies infection. But what I'm being told is that there are at least 24 cases, right? And I can give the breakdown for you again. On Ward 6B, 2 cases. On Ward 8B, 15 cases, which is all the patients on the ward. Ward 9B, 3 cases. Ward 10B, 2 cases. And Ward 9A, 2 cases. That would be 24 cases in total. Up to yesterday, when I received the information, there were 6 nurses who were infected, but I was told today that another nurse has been infected, so that will take it to 7 nurses. Nurses were coming in since January and bringing in papers from their doctors speaking of environmental concerns at the geriatric hospital. These environmental concerns go beyond just the scabies, but there's also issues with birds dropping dead in the facilities and dropping from the roofs on the wards. There are rats running through the wards and on the roofs, all of those things. I think I have pictures which we will show later of some of the birds dropping dead. And if you have a situation where birds are dropping dead on your compound, it speaks to an environmental issue, and that this is something that should be investigated. So we need to know how often do the environmental health officers actually visit the geriatric hospital? How often do you see environmental health officers within the communities in Barbados? This is also a concern. This is a health and safety risk, and right now they're in breach of the Health and Safety at Work Act. Because one, you should not be forcing nurses to go on wards with infected patients and not providing them with adequate PPE equipment in order to protect themselves. So that should not be allowed. And if a nurse refuses to go on a ward with an infected patient, you should not be threatening them with docking their pay. You should be looking to provide them with the resources which they need in order to do their job adequately. Because at the end of the day, the nurse also has to look out for their families as well and not to take scabies back into their homes. That is all that they're asking for the appropriate supplies and PPE equipment so that they can do their job following the appropriate protocols.
You're saying that some nurses were intimidated?
That is the information that I am receiving, that even though their unions had asked them, given them certain instructions, that they're being intimidated by management, that if they do not go on the wards and do the work, that their pay would be docked.
And I guess, do you think somebody needs to be held accountable for this particular outbreak?
This has been going on since January. I think that the Minister of Health needs to come and speak to the matter. And in terms of holding someone accountable, it is the Minister of Health that needs to be held accountable. It is a trickle-down effect of poor management. Now, you have a ward to manage or a hospital to manage. If you are not getting the resources to buy the adequate supplies, you are going to try to manage it the best way that you can. That is the situation that we have fallen into at the geriatric hospital. And as a result of that, you have management making poor decision choices to make up for the shortcomings. You're on the staff, you don't have the PPE equipment, you have a laundry facility that is not working, you have not done the contact tracing, which should have been done since early January and prevented the spread. You also place infected patients on ward with persons who were not infected, and because of the close proximity of the patients in the wards, it is highly likely that the infection will spread given the nature of how scabies is spread. So yes, someone needs to be held accountable, but in this situation, I believe it is the Minister of Education and the lack of proper funding and resources, the Minister of Health, sorry, and the lack of proper funding and resources being given to run the various departments. And that problem with funding is not unique to the geriatric hospital, but the psychiatric hospital is facing similar staff shortages and similar lack of resources. Same thing in the Queen Elizabeth Hospital, same issue in the polyclinic. So that is why our healthcare system is in crisis.
And then lastly, do you think that perhaps they have an adequate plan in place to ensure that something like this doesn't happen again, or perhaps if it does happen, it doesn't happen to this extent?
Well, the geriatric hospital has an infection control nurse who should have taken charge of this situation. But if you are in an environment where you are not going to be upfront, because from what I explained before, the staff were not being told what was happening. The staff learned about the scabies outbreak from the media, just like the average Barbadian. Same too for the family members with patients, patients at the geriatric hospital. This is a breakdown of communication, and this is a breakdown in management. So clearly, the protocols are not being followed, and it seemed as though the situation all of this was supposed to be contained and not get out to the public. But obviously, right thinking, Barbadians, and that is why we need whistleblower legislation, so that when you see things like this happening, you need to speak out against it. And that is the only way that we will correct these issues in this country. We have a government that campaign on transparency, but yet they're doing the complete opposite to it. And I think it is something that all Barbadians should watch and speak out against.
We have a question online where someone is asking what is happening to the hospital in St. Lucie at some point.
Well, as far as I know, the hospital in St. Lucie at some point is not being utilized, and it should be put into use, because after spending so much money to stand up such a facility to get it operational, you should not close it down, because then you will get the issues of sick building syndrome, the air conditioning units developing mold, and it would probably take a lot more money to stand it up again if you need it. Right now, I believe that unit should be in operation to help take some of the burden off of the Queen Elizabeth Hospital. And if it was in operation, it perhaps could be used to take the infected patients from the geriatric hospital in an area where they can be isolated and properly treated.
There's also a second question that asks the maintenance of equipment. How long has the laundry facilities been out?
Well, I cannot say definitively how long the facility has been out, but I would hope that they do what is necessary to get it operational, because you do need hot water, not just to treat scabies, but any laundry within a healthcare facility needs to be properly sanitized with hot water. So that is something that needs to be dealt with urgently.
And someone is also questioning the payment for the hazard payment. What about the hazard payment?
The hazard pay at the geriatric hospital only go to the nurses who work on the isolation ward. The isolation ward was set up to deal with patients who contracted COVID, and there are a few nurses who work on that ward. Now, if an infected patient is carried onto another ward, those nurses will not be entitled to hazard pay. In a situation where there is a widespread outbreak such as this, I would hope that the unions advocate that all nurses receive hazard pay while dealing with the outbreak at the geriatric hospital. That is only a fair measure, and also that they have the appropriate PPE equipment as well.
And of course, there's a question about regathering. If some of the regathering money can be used or diverted to address these critical problems in our healthcare system.
I believe that the problem arises because of lack of funding, because if you're in a situation where you are issuing 6 bars of soaps to a ward to be shared over 3 shifts. Now, the way how they operate, you have the nurses in the morning, they will do cleanup. They would also bathe the persons again around 11:30, and then the night shift would probably do cleanup again. Can you imagine 6 bars of soap lasting for an entire week? Before, you would give the 6 bars of soap as a start. And if you run short, you will get additional supplies. So the whole situation has arisen because, one, lack of supplies. If you have the rats and the birds dying on the property, it means that they're not being properly cleaned. Again, lack of supplies. I understand that they're even rationing the amount of cleaning supplies that they're given to clean the area as well. So yes, I think that the government's priorities are off. The money spent on regathering could have been better spent in terms of shoring up the situation in the healthcare facilities and also cleaning up the schools, because you still have schools closing on a weekly basis because of environmental problems, which goes back to a lack of resources for cleaning equipment and to properly clean the environments of the schools.
There's a comment from a person who appears to be a nurse that said, this is over 5 years, we are still awaiting hazard pay from COVID-19.
And these are issues that need to be addressed. The hazard pay was promised by the government, and our frontline workers gave their all in terms of dealing with COVID. We have a number of issues within the healthcare sector. I'm putting the Ministry of Education on alert because I do intend to have a press conference to deal with the psychiatric hospital as well and the issues that are being faced by persons working in that facility. All of these things go back to money. You also have a situation where you're bringing in nurses from Ghana who are not properly trained, who are being paid more money than Barbadian nurses, who are blocking entry into the nursing profession for Barbadians. And you have the Barbadian nurses having to turn around and train or supervise these nurses to make sure that the jobs that they're given to do are done to the correct standard. All of these are things which needs to be addressed within the healthcare sector in Barbados.
In terms of the Democratic Labour Party, are you committed towards doing better in this regard?
Well, definitely. Hearing the information of the infections on the war, this is something that hurt me. That I am not comfortable hearing about this. And I know that the Democratic Labour Party can do better and will do better once given the opportunity to address these issues as the government of Barbados. We have always operated on the platform where we believe that Barbadians should have decent access to health care. You saw it at the Queen Elizabeth Hospital when Dr. Dexter James managed the Queen Elizabeth Hospital, so we know that it can be done. We know that we can bring down the wait times in accident and emergency. We know that we can provide adequate services not only at the geriatric hospital, the polyclinics, and the psychiatric hospital, but all of these issues go back to our frontline staff are not being properly taken care of. There are human resource issues, and we need to realize that we need to treat not only the doctors, but the nurses and everyone who works in the healthcare setting as professional. And that would be the direction in which the Democratic Labour Party will take, because healthcare is important and critical to every single Barbadian.
There seems to be evidence of that, of what you just said, because I think the Besto Santos lab was built well in advance of the COVID outbreak and became a very useful infrastructure for the country at that point in time. What are you going to do with that?
Well, definitely, because you have to be strategic in your thinking and your planning. Because you recognize, I think the Besto Santos lab came out before COVID. There was the name slips, the Ebola, and the possibility of Ebola coming to Barbados. And we recognize the importance of being able to do those tests rapidly and not having to wait to send tests outside of Barbados to come back to Barbados to be tested. We also did what was necessary to reformulate the drug service because we recognized that the cost of the drugs was becoming prohibitive. So we needed to address that as well. And also the health and wellness program was important because the issue with many Barbadians are non-communicable diseases, and which can be easily treated by having a healthy lifestyle, which includes diet and exercise. So all of these are planks in which the Democratic Labour Party has executed well before and has the capacity to do that again.
Now that you took that on COVID, there has been a recent statement by a medical practitioner that a new strain of COVID is likely to come to Barbados. Any word on that information?
Yes, we did hear the press conference yesterday, but even prior to hearing this, we have heard news that there are wards at the Queen Elizabeth Hospital which possibly have outbreaks of COVID. And we've been hearing this now for almost a month. So whether or not the strain is here, because I do know that we're not necessarily publishing the COVID tests or the amounts of COVID positive cases, and we may not necessarily be sending the samples or the strains to be analyzed to determine what variant of COVID is there. But I think that all of this, the healthcare in a country needs to be transparent, open, and upfront with the people, because the persons must have confidence that the information being put out by the health authorities is accurate and that they can trust this information. So COVID has not left us. and it will probably be with us for a number of years. And I think that we have reached the stage where we can be upfront with the people of Barbados and let them know if there are cases of COVID. Over the last couple of months, you had a number of persons dying from respiratory illness. As you're not testing to determine whether or not it is COVID, all of these things should be done, but you need to be upfront with the people. COVID is not going to leave us, and it will probably be with us for a number of years. So just be upfront with the people and let them know what is the true situation. If you have wards at the hospital which are closed as a result of persons being infected with COVID, let the public know, because then persons will take the necessary precautions. Because if you have a vulnerable person living in your household, you should still be using a mask when you go into certain places. If you have a condition which makes you vulnerable, you should still be using a mask and your hand sanitizer when you go out. So all of these are important so that people will do what is necessary to ensure that they take care of themselves.
We're also seeing government placing a lot of emphasis on things like climate change and those kind of quote-unquote sexy sounding terms. But yet still, you are bringing to us today issues and concerns that are affecting people in their personal lives. What can the Democratic Party assure us they will do in relation to taking care of our people?
Well, I think that our people come first. Climate change will definitely affect us because of the weather patterns and so forth. So yes, we need to do things to deal with climate change. But I think that you're more so speaking of talking on the international stage, but you're not doing anything in Barbados to implement these things. So we hear a lot of buzzwords about climate change and technology and resilience, but we're not necessarily seeing it being done within the country, because you're not seeing it within the educational sector. You're not seeing it within health. And if you don't have those two correct, the society will continue to fall into problems. You're not seeing it in the work environment with job opportunities for young people. And as you go, that's the number one cry for young people, that they cannot get jobs. So you cannot just use the buzzwords to get attention and not necessarily put the programs and action in place within the country. Although we are still dealing with sargassum on our beaches, and we have not yet devised an adequate program to deal with it before it comes on shore, to utilize it as a resource, or to clean it up from off of the beaches if it does come on shore, so that the beaches become available and accessible not only for the tourists, but for the locals as well.
What advice would you give the every citizen given your recommendations today?
My advice to the average Barbadian, as I said, for the nurses and persons who have elderly patients at the geriatric hospital, it is your right and is your duty to call and inquire on their state and how they're being taken care of. For persons who work at the geriatric hospital or believe that they would have come in contact or can possibly come in contact with infected persons, I would have read out some preventive steps that can be taken. Follow those steps: proper hand washing, and also proper washing of your clothing and linen as well, until the infection has been completely under control. If you think that you have any issues with it, go to your doctor, because it is a disease that can be easily treated, but you need to treat it for the entire duration and the course of the treatment. And for Barbadians, be very vigilant and speak out. If you see or if you notice that something is happening that should not be happening, we have to develop a culture of speaking out against it, because that is the only way that it will be corrected, because we have a government and a media to some extent that seems to be suppressing information, and we are learning of things only at the last minute and not getting the full details, and that puts the country at risk.
There was a statement made earlier in the month, or could have been late last month, about mental health and young people. There seems to be an increase in incidences of young people being affected mentally and are not really open in the situation. Any position you have on that?
Right. I think we do need to take mental health seriously. And again, you can't just use buzzwords because that is the topic of the month. We have a situation in Barbados where we are not treating mental health seriously. As I said to you, I want to come back to the geriatric hospital at some point in time. The geriatric hospital is severely understaffed. You cannot be treating mental health seriously in a situation like that. You need to have more counseling services available for young persons. Not only young persons, but everybody goes through challenges. And we need to develop a culture where it is easy for you to access the counseling that you need, because you may only need to have a conversation with someone who will then direct you to the professional where you can get the appropriate treatment. So you can't just use mental health as a buzzword and not put the resources behind it, making counseling services adequately available. How easy is it for you to go to a polyclinic and say that you would like to speak to a psychiatrist or a psychologist, you're going through an issue? How easy is it for you? We don't have the things like the drug treatment court. All of these are things that lead to that impact on mental health. These are things that should be easily accessible. With a number of young people turning to drugs, alcohol, and marijuana, you've seen a number of situations where persons have been acting out, and which are possibly due to are drug related as well. How easy is it for such an individual to get the adequate counseling and access to support that they need? Because part of the decriminalization of marijuana was to make drug treatment courts available, so that instead of criminalizing an individual for marijuana possession, you gave them the opportunity to go the channel of the drug treatment court to help them to get off of the drugs, not just marijuana, but any drug that may be causing an impact on them. So it could be alcohol, it could be marijuana, anything like that. So you cannot just use mental health as a buzzword and not put the resources in place to make sure that people have access to the treatment that is necessary. And you cannot be serious about mental health if you have a poorly staffed psychiatric hospital and an outpatient clinic program as well.
There were some comments about the pension, where the pension goes, non-contributory or otherwise, but the answer seemed to be coming as well. They said that if the pension is non-contributory, it is stopped on admission. And if it's contributory, it goes to the family. But the final question is, someone is asking you once again to indicate the steps necessary, repeat the preventive steps against HADs.
Okay.
Given your position earlier, you made a revelation in terms of the fact that we must be concerned about it. Of course, if you must be concerned, you also must know how to prevent.
Right. Okay. So I'll go through again. To prevent the spread of scabies, a highly contagious skin infection, please follow the following hygiene and treatment protocols. 1, treat all close contacts. Everyone in the household and anyone with prolonged skin-to-skin contact should be treated, even if asymptomatic. 2, avoid skin-to-skin contact. Refrain from direct contact, including sexual contact or bed sharing, until treatment is completed. 3, wash clothing and bedding in hot water. Use temperatures of at least 60 degrees Celsius and dry on high heat. Items that can't be washed should be sealed in plastic for at least 72 hours, because the scabies might require contact with the skin in order to survive. So if you seal it in a bag for 72 hours, it would eventually die. 4, vacuum thoroughly. Clean carpets, mattresses, and furniture. Dispose of vacuum contents immediately after use, because you're trying to get rid of any shedding of the skin so that the mites would not have anything to feed on. 5, do not share personal items. Avoid sharing towels, clothes, razors, or bed linen. 6, follow treatment carefully. Use prescribed creams or lotions as directed and apply them to the entire body. A second treatment after 7 days may be necessary. And 7, monitor for symptoms. Watch for itching, rash, or burrows, especially around fingers and wrists, elbows, or waistline. And 8, notify close contacts. Inform anyone who may have been exposed, including schools or elder care facilities. Now, as I mentioned earlier, even if persons are asymptomatic, and I would have mentioned that infected persons were placed on wards with persons who were not infected. So it would mean that all of the persons on those wards will now have to be treated as though they have scabies in order to reduce the spread of scabies. These are the things that you need to do to control the spread of such an infectious disease such as scabies. And I also want to remind persons that scabies, even though it's highly contagious, it is treatable. It will just give you a discomfort for the period of time. Itching, and the itching could last for a few weeks or months, but it is best to treat it as soon as you recognize that it is scabies. So with those words, I want to thank you for joining me for this press statement on the scabies outbreak at the geriatric hospital. And I again urge the Minister of Health to come to the public of Barbados with the facts and all of the details regarding the outbreak at the geriatric hospital and put the necessary measures in place to make sure that our elderly and our frontline staff, the doctors and the nurses within the geriatric hospital are given the best care and attention which is necessary to prevent the spread of this scabies outbreak beyond the walls of the geriatric hospital, but into the wider community. Thank you very much and have a good evening.